The truth is, pandemics happen. They have happened through history. There is no reason to believe that the 21st century will be any different. Now, all of you understand why it is that we're concerned today. This H5N1 virus is sweeping across the world. I had been secretary for maybe 4 months, and I had on my schedule an emergency briefing from the Centers for Disease Control, and they came to explain to me that there was a virus, the H5N1 avian influenza, that they believed could have pandemic potential. The next morning, a young colleague of mine, a man named Stuart Simonson, came into my office very early. He had 2 books. The first book was The Great Influenza, A History of the 1918 Pandemic by John Barry. He set it on my desk and said, "You need to understand this." And then he set a second book on my desk, which was a congressional investigation into the 1976 swine flu and the vaccine that ultimately was produced and put into the arms of millions of Americans and actually created lots of sickness. And he pointed to that one and said, if you don't get that one right, there's going to be one of those, and it's going to be about you. And that got my attention. Pandemics are a fact of life. They're part of the microbial world that we live with. You can look through the entire history of humankind and see pandemics, not just that they occur, but when they occur, they reshape the world.
For Mike Levitt, the books were an awakening, and he passed one of them along to the president.
I have thought through the scenarios of what an avian flu outbreak could mean. I tried to get a better handle on what the decision-making process would be by reading Mr. Barry's book on the influenza outbreak in 1918. I would recommend it.
He's out at his ranch at Crawford, and he reads this John Barry book, and he comes back. This is 2005, the summer of 2005, and he calls me into the Oval Office and hands me a copy and says, "You must read this book. We have to do something about this." Now, you can imagine it's post 9/11. Counterterrorism is an everyday, all-day job. We are disrupting threats, and then the last thing I think I've got time to deal with is flu. And I say to him, how much of a priority should this be? And it was interesting, the president understood at that time, look, this is the 100-year problem. It may not, likely won't happen on our watch. But that doesn't mean we don't have a responsibility to have a national strategy, that the next team or the team after that can pick up off the shelf. They'll make it their own, they'll make changes, but we owe it to the country to have them be prepared.
Our country has been given fair warning of this danger to our homeland and time to prepare.
And so we brought together a cross-sectional group of people from agriculture, environment, education, health, to plot out a way forward. How could we begin to bring a virus under control that was circulating in animals and really minimize the risk or the impact on the people?
From the beginning, we recognized that we needed to take a comprehensive view of the threat and do everything possible to protect against the emergence and spread of a pandemic virus.
We knew that you'd have to have testing, wide-scale testing capability, and contact tracing.
In a pandemic, everything from syringes to hospital beds, respirators, masks, and protective equipment would be in short supply.
We understood that it was likely in a pandemic the size of the 1918, for example, that the hospitals were going to be overwhelmed, and we will lose more Americans in a pandemic if we're unprepared than we lose in a war.
So to meet all our goals, I'm requesting a total of $7.1 billion in emergency funding from the United States Congress.
And so that analogy was important in terms of explaining to Congress, it came with a big bill.
New Orleans thought it had been spared the worst, and then 2 major levees broke, and slowly the city filled today with water.
In New Orleans, Hurricane Katrina had shown the terrible cost of government inaction and the need to prepare for unlikely but devastating events.
Katrina did teach Congress and the public that it's not a waste of money or time to prepare for the 100-year event, because that it may happen now. We may be due.
The devastation wrought by the hurricanes the last few months has shown us we can't stop forces of nature, but as the wealthiest country on earth, we can prepare and we can respond in a way that saves as many lives as possible. That's what we have to do with the avian flu. We're encouraged that the administration has finally released its preparedness plan, and we look forward to working with them on implementing the strongest version possible as soon as possible.
In 2006, Congress passed the Pandemic and All Hazards Preparedness Act. It required states and hospitals to start planning for a pandemic flu.